No. Okay. Hi, everyone, and welcome back to another session with Dental Shadowers. Today, we are joined with Dr. Kamodia, who will be teaching us more about general dentistry. Thank you so much for being here with us today.
Yeah, thank you for having me. I am really excited and just want to warn everyone, my dog will make appearances over here on the side. I am Dr. Shivani Kamodia, and I am a general dentist. I'm just going to flip to this first slide here as I tell you a little bit about myself. So I graduated from University of Michigan in 2018. So I am a recent grad. It's pretty crazy. I've been practicing for close to 3 years now. Time has really flown by. I'm originally from upstate New York, so I was born and raised in Binghamton, New York, and I went to undergrad at University at Buffalo. My dad is a general dentist and he has a practice in Vestal, New York, where I was growing up. And my sister also went to dental school. So a lot of dentists in the family. And I'm sure a lot of people watching are also from dental families. So you get a really good idea of what the lifestyle entails. And yeah, my journey into becoming a general dentist. So, like I said, I went to University at Buffalo. I did a special major program there. I originally was just majoring in biomedical sciences, and during my undergrad career, I became really passionate about environmental studies as well. So, sustainability and learning all about reducing our impact as healthcare providers on the environment. And I Buffalo has a really cool program. If anyone goes there, definitely look it up, where you can kind of create your own major. So I was able to find my own advisors, and they had to approve like which courses I took. But it was a really fun opportunity for me to take some classes that I probably wouldn't have been able to take. And so that really sparked something in me as an undergrad that I've been continuing on since then. Um, Something that's interesting about me that I did during undergrad, which I highly recommend for others who are having this time right now, is utilizing the summer breaks that you have. Um, I, in undergrad, remember a lot of my peers who were applying to dental school did research programs, um, or stayed on campus, did things like that. I know travel is not super accessible right now, but hopefully it's changing. But I was able to travel a lot during the summers and I found some cheap ways to do it. So I spent a summer working on organic farms, which is really cool. I did a yoga teacher training. Um, and that was like a month-long training, and I still teach yoga to this day, which is awesome as a dentist. And I did a semester abroad, and I kind of bookended my semester abroad with more traveling. So highly recommend to like get out there and get your experience. I think once you get into dental school and get going, it's hard to stop. And then after graduating, you may think, okay, when I have more time, when I'm done with dental school, I'll be able to travel more and do more stuff, but it never really is the case. So don't wait, do it now. This is actually, I think undergrad is the perfect time. So highly recommend that. And like I mentioned, I went to University of Michigan for dental school, graduated in 2018. Both my dad and my sister went there, so I had to keep the legacy alive. And I actually met my now husband in dental school. We were in the same class, and he is sorry about that. He is specializing. He's a prosthodontist, so he is doing 3 years on top of just regular dental school, and he is here at the Health Science Center in San Antonio. And so that's why I moved to Texas. I started working in, so we've been here, this is our third year that we're here. It's a 3-year program. I started working in corporate as it was the easiest way to find a job from out of state. That was really challenging moving from Michigan to Texas. I didn't really have any connections, and it's hard to find smaller private practices from a different state. So I found a corporate job through Pacific Dental Services, and they're probably one of the better corporate organizations that are out there. There was a lot of training involved. It was a great learning opportunity, but it's a lot of hard work. So I eventually transitioned into a private practice, and that's where I've been now for the last 2 years. And then after we leave San Antonio, we are actually moving abroad. So that's going to be a whole nother experience with practicing dentistry abroad. But my husband did the Health Professional Scholarship, which is through the military. It's called HPSP. So highly recommend that you look into this if you have ever thought about serving in the military. But it was a full scholarship for dental school in exchange. So it was 1 year of school for 1 year of service. So they paid for all of his dental school. And then he started getting paid and a stipend through his residency. And so that's 7 years. And so now he'll owe back 7 years. And he came out of dental school with zero debt, which is incredible. I think a lot of people don't think about the debt until after the fact, but student debt is a big thing. And it's a really, really great opportunity. And that's something I think in your sophomore, junior year of undergrad that you can start reaching out to recruiters for. And it's something in retrospect, had I known that was an opportunity, I would have loved to do it. So definitely check it out if this is a new term for you. I wish I could give you more information, but again, like I said, it was my husband. But I'm sure there's more information I could provide if you email me after. Okay. So I kind of touched on some of this advice already. I wanted to talk a little bit more about lifestyle things as opposed to, like how to study or things like that. Authentic life experiences mean more than just checking the boxes. And so this is pretty practical in terms of your application and when you're going for interviews as a dental student or as a pre-dental student. I think experience that you're passionate about. And when you are really interested in what you're doing, it shines through your application and through your interviews. So instead of simply like joining a club because you think it looks good on your resume or it looks good on your personal statement, don't do that. Fine. And even if it's off the beaten path, that you're something that you're passionate about, still pursue it and still go down that path. It may have nothing to do with dentistry or healthcare, but it can really set you apart. And I think it can really give you a better experience, a more fulfilling life. And you'll have better memories. You'll probably connect with friends that you wouldn't have otherwise met. And so, like, my example was picking travel over research. I also was really involved with environmental clubs in undergrad as opposed to like the dental organizations. So I think I didn't necessarily mingle a lot with the pre-dental people, but as I was interviewing and whatnot, I was able to talk about these other experiences, and I think that shines through. And then my other piece of advice is to start learning and practicing personal growth and personal development now. Unfortunately, I hate to say it, this is probably the least full your plate will be as you continue through life. And so, starting to just lay the groundwork for healthy habits now. So, when your plate does become more full, when you start dental school, when you start your own dental practice or start working, you're already set up for success. And these are things that many of you are probably already doing. So, healthy nutrition, making sure you're working out, having healthy habits for sleep, and then just enriching your life with good books and podcasts and maybe taking weekend courses. And this is regarding like outside of the realm of school and science. So looking into like leadership or business. I'm really into personal development, and that can be like in a physical sense, like as a yoga teacher, or it can also be in the mental sense. So just learning to manage your emotions, stress management, things like that. So I put a little image of the books I recommend actually on this side. These are just a handful of the books that I really enjoyed and that I think have made a big difference for me over the past few years. Some of them I read before dental school as a pre-dental student, and some of them I've actually read as after I have started working, and I wish I had read them sooner. So you can kind of look through the list here. I had some like, mental health ones. I would highly recommend The Defining Decade. It's about how your 20s, living through the decade of your 20s is a really defining age. And this is such a pivotal point that you all are at. The 5 a.m. Club is a really great book about building a morning routine. And if you're into nutrition, these are two really great books about fiber that I'm passionate about. And then there's so many resources with podcasts as well. So Brene Brown, I love her. If you haven't heard of her, definitely look into that. Ed Milet, Tim Ferriss, these are all like bigger names in personal development. Once you find one, they kind of all go off of each other. So there's some recommendations there. Okay, so now getting a little bit more into the dental aspect. So what is general dentistry? It can be quite overwhelming. It's really being a master of everything. So my days can be literally doing every type of procedure. Sometimes we joke around, and I think some specialists can feel this, is that general dentists can be the master of none, meaning that because we don't specialize and really focus in on one type of procedure, we're not really a master of anything. I like to, I think, beg to differ, but I think what the big thing is I am, you know, how you would have like a PCP, your primary care provider. As a doctor, as a dentist, I'm like that. I'm your primary care provider. So I coordinate treatment with all the different specialists. If you need specialty treatment like ortho, perio, or endo, oral surgery, I am the connector between it. I maintain that dialogue with the other specialists. And a lot of what I do is preventative. So for most of you watching, you probably just go in twice a year, you get your 6-month cleaning, and then the doctor comes in and does their 5-minute exam, and that's that. So a lot of my day is spent doing these recall exams. As people age, or if they come from different socioeconomic backgrounds, they may not have the same situation, meaning there could be a lot going on. There could be a lot of decay or broken teeth or pain. And so these 6-month exams, recall exams, are a chance for me to be able to see what's going on. The biggest thing with general dentistry is restorative. So fillings and crowns. I feel that's probably what I would say 75% of my procedures is restorative. And a lot of the examples I have in my cases are going to walk you through what that process is like. I work at a practice where we have CEREC technology. Actually, since I graduated dental school, I've only worked at places with CAD/CAM, which is digital, and it is the best thing in the world. I would say as a general dentist, I identify like my specialty within general dentistry is CEREC. So being able to do same day crowns is a huge asset, and I think such a service to the patient. I also do my own oral surgery. So I do extractions and bone grafting. I do endodontic treatment. So I do root canals for simple to moderate cases. And I do a lot of cosmetic work. So anterior crowns or veneers. If someone is unhappy with their smile, I'm there to help fix it. And anything that I am not able to do, I refer out. So I think that's one of the challenging parts of being a general dentist, is knowing where your limit is. It is our responsibility, and it is my duty to the patient if their treatment is out of my scope of practice, meaning it's too complex for me. It's my responsibility to refer them. Now, there's no one policing that. There's no one, checking my cases and saying, this is out of your league. You can't treat this patient. It's really like being an honorable healthcare provider and just knowing your limit. And I think that can be where there are challenges for general dentists. I think we all like to think we know more than we do. And so going in with uh, every patient I see, being honest with them and with myself. And then there's a lot of room for growth. I think that's one of the best things about general dentistry is you can still specialize within general dentistry. Like I said, for me, it's digital dentistry. There are a lot of general dentists that just do a couple of procedures and that's all they do. And there's a lot of room for growth. So as I master the procedures that I'm currently working on right now, and I want to grow, I can start placing my own implants. I can start doing a little bit more orthodontic treatment. I think clear aligners are a really awesome treatment for patients as well. And then even more complex treatment, full mouth rehabilitation. So lots of room to grow as a general dentist. So what is my typical day like? I work Monday through Friday, 8 to 5, and actually Fridays, the practice I'm at are half days. And I think full time as a dentist, I didn't realize this until probably about a year ago. I was like getting really burnt out working Monday through Friday, 8 to 5. I was like, this is a lot. 40 hours is a lot for on your body and on your mind. It full time as a dentist, I think is considered 30 hours actually. So I was working 40 hours and I was like, oh my gosh, this is terrible. I don't know if I can do this for my whole life. But no one told me that that as a dentist, actually it's better to work fewer hours. So I'm starting to taper down and you will probably see this as you hear other dentists speak and as you get into the field that you become more productive the less time you work. So, there's that saying, the time it takes for you to complete something will expand into the time that's available. So if I have 3 hours to do something, it's going to take me 3 hours. And if I say I'm only coming in these 3 days, then I'll get more done in 3 days. I hope that makes sense. Anyway, so the practice I work at right now, it's myself, and then there's one other general dentist who's the owner. There are 2 hygienists, and the hygienists each see 6 to 8 patients a day, so pretty much a patient an hour. And as the general dentist, I am the sole, I guess, the main provider for them. And I do exams for the patients and I administer anesthetic. In Texas, hygienists can't do their own anesthetic, not yet. So I am constantly, as I'm seeing my own patients, I also have to be mindful I'm seeing like 12 to 16 patients in another room. So there's a lot of going back and forth there. And then my own schedule, I can see anywhere between 2 and 10 patients a day. So sometimes my schedule is packed full with scheduled treatment. Sometimes, like today, actually, I only had like 1 or 2 patients on the schedule, and we had quite a few emergencies call in who needed some treatment done right away. There are also new patients that are constantly coming in who are finding us on Google or are referred by family and friends who want to come in as well. So my days are kind of unpredictable and that's fun. It's hard to get Sunday scaries when I'm going into work on Monday and I have no idea what's on my schedule. So that's a benefit. So as a general dentist with CEREC, I do a lot of same day treatment, which means I do a lot of crowns in one day, and that process takes about 2 hours. I do a lot of root canals and a crown in one day, which takes about 3 hours. And that is typically, I like that type of workflow because instead of seeing like 20 patients a day, I'm seeing fewer patients, but I'm able to complete more treatment. And it's just less stressful. I don't feel rushed. It's a really great setup. And when I'm not seeing patients, I am writing treatment notes, so documenting everything that I'm doing when I'm working on patients. There's a lot of online CE, just like how you're doing some virtual shadowing. I learn a lot online. I do online courses. And then working on other projects, I've got a couple side hustles that I'm really passionate about. So always finding ways to keep myself busy. And that's a little bit what this slide is. So typical day in general dentistry ends at 5 p.m. for me. So after 5 o'clock, I do not think about work. I think one or two times I've had, to plan a more complex case. I brought my photos and materials home, and I was able to kind of do some planning. But for the most part, work stays at work. I've rarely had emergencies on the weekends or during the holidays. And if depending on where you work, you'll probably have a very similar system. That's a great benefit of being a dentist, because my evenings and my weekends are for myself. So I spend a lot of time with my family, resting. Like I said, it can be pretty hard on your body. Getting outside, working out, teaching yoga. And something else, as a general dentist that's only 2 years out of school or 3 years out of school, I still live like a student. So, loans are a real thing. And just finding ways to keep myself busy and interactive, constantly learning, saving money. And I think as driven people, I kind of expected after dental school, I would just be able to chill out once I start working after 5 o'clock. I just kind of like sit and relax. And as really driven people, it's hard to just sit and relax. I think we're constantly wanting to grow and learn more and become better people. So that's what I meant by live like a student, as the learning never ends. Okay. So as a general dentist, what kind of complaints do my patients present with? Like I said, it's honestly everything. So a lot of times we see periodontal disease or different levels of that, and that is scum disease. So what would be the treatment for that? It would be with a hygienist, scaling and root planing, which we call to the patients, it's called gum therapy. We refer to it as that. I have a lot of patients come in with cavities. They say their teeth are really sensitive to sweets, or it hurts when they drink hot coffee. And so after we figure out what's causing the pain, we can restore those teeth, and those will either be fillings or crowns. Some other complaints I hear are like there's a hole in my tooth, or it really hurts when I'm biting, eating something. What do we do for that? Typically, it's a broken tooth, and broken teeth can be pretty complex. So if it's restorable, if it's fixable, then we will either do a root canal and crown, possibly not have to do root canal. And in some cases with cracked teeth, they have to come out. A lot of what I do is working with old dental work. So I think a complaint with patients is, I've had this filling for 30 years. Why is it all of a sudden need to be replaced? That's a huge complaint. I don't think patients realize that all dental work eventually needs to be replaced. There's a lifetime on it. I use this analogy that it's kind of like the tires of your car. You use them every single day. You use your teeth every single day, multiple times a day. Think of how many thousands of meals you've chewed with that filling, and you expect it to stay perfect for 30 years. That's not going to happen. So eventually things need to be replaced. So every 10 or 15 years, you may need to replace your fillings or your crowns, and that's normal. So a lot of what I do is replacing old fillings, old crowns. There's a lot of metal work still in people's teeth. So that's like amalgam fillings or metal crowns, and they tend to break down the teeth a lot. They can cause a lot of fractures. And then I hear this complaint a lot: jaw pain. I have a lot of jaw pain. I clench and grind my teeth. What can I do? And that's a pretty complex issue as well. So evaluating the bite and treating it with equilibration or a night guard. And what that means is your jaw hurts sometimes because your teeth aren't well aligned. And we can either realign your teeth so they are coming together in a safer way that's going to protect your joints, or we can give you something to just where instead of grinding your teeth against each other, you are now going to be having a night guard. And it's actually technically called an occlusal guard, and there's quite a bit of science behind that. I'm not going to get too into depth with that right now, though. So those are some of the complaints: bleeding gums, pain to hot and cold, pain to biting, old dental work that's breaking down, jaw pain, things like that. Oh, and another really big one is, I don't like how my smile looks. I want a nicer smile. And that kind of leads me to my first case. So this was just a simple one to start with. I had a patient who is a regular patient. She really only comes in for her 6-month cleanings, and all of her teeth are really healthy. Actually, her 2 front teeth, you can see they're a little discolored here. They were still healthy. The fillings, although are stained, there was no cavities. But after about 2 years of getting to know the patient, so I had seen the patient 4 times, and each time I said, if you have any concerns with your smile, with the 2 front teeth, you just let us know. And it took a little bit of time to build some trust with her, but eventually she decided, right before the holidays this year, that she wanted to change her 2 front teeth. So I did some conservative preparations on the 2 front teeth. Actually, these are crown preps, so not super conservative, but realistically, I only took about 0.7 of a millimeter off from the facial, so off the front side. And the reason we did that, again, is there's a lot of discoloration of the 2 front teeth, and she had like really big fillings. I don't know if you can see my mouse move here, but
We can. Sorry to interrupt. We can see
okay,
your mouse.
awesome. Perfect. So like you can see in this before photo, there's like really large fillings. You can kind of follow the margin right there where there's a lot of staining. So that was the challenge of the discoloration of the teeth. And actually, this tooth right here had a root canal done. And sometimes when there is a root canal, and the nerve is dead, the tooth can discolor. So if you can see here, after I removed kind of that first millimeter of enamel, this other tooth that had the root canal is still a little more discolored. So we needed to mask that a little bit. So our solution, like I said, was to do some crown preps, and the patient did some at-home whitening for 2 weeks before we did this preparation here. She really wanted a brighter, whiter smile. So when we put porcelain or composite filling material on a tooth, it's going to stay the color that it is the day that we put it on there. So I told her, if you want whiter teeth, go ahead and whiten your teeth until you're happy with the shade. And then when you're happy, let's give it 2 weeks or so for kind of the teeth to settle, I feel like settle in, and then we'll make your crowns. So that way we can match the shade of your teeth when they're the whiteness that you want. So if we had, let's say, placed the crowns before she did whitening, they would have stayed, they would have looked darker or a little more yellow compared to her teeth after whitening. So this was during the preparation day. So this was a lab case. I actually did not do it in office with the CERC. I wanted to use our lab because they do really great, beautiful work, especially for the front teeth. So what's important, like I mentioned, is the shade of the tooth underneath. So when we layer porcelain on top of a discolored tooth, that discoloration can just kind of shine through because our materials are translucent to mimic the natural tooth. So we take what's called a stump shade. So this is showing here that this tooth is about a shade A1, this tooth is about an A3. So this is what's underneath. So I take these photos and I send them to the lab. And then this is a photo showing here that her other teeth, especially the ones on the side, are a shade BL3, which is a really white shade, actually. It's like one of the bleach shades. So this is what we found was actually going to match. And when we had her crowns made, we asked them to be made this color. So after I took these photos, and I'm sorry I don't have photos of the whole process, but what we did was take a PBS impression, which is, I don't know if you've ever had impressions taken before. It's like a tray, and we put material in there, and pop it in the mouth, and it comes out very detailed of what these crown margins are. So right along where my mouse is going right now is where the margin is, and that's where the porcelain and the tooth meet, and that's like the most important part of any crown or veneer. So we need to capture that to send it to the lab. That way they can make something that fits perfectly on top. And then after we took these photos and we took our impression, we made provisionals. So provisionals is just another word for temporaries. And we use a temporary acrylic material. We actually took an impression before. So in this first photo here, we took an impression of what these teeth looked like. And we kind of put that off to the side. And then after we prepare the teeth, we fill that impression with our acrylic material and put it on top of these teeth, and we make our temporaries. So this is the before and after. I'm sorry I don't have more in between photos, but I've got some other cases that show the steps better. But you can see here, so if I was being critical of my own work, I was not super thrilled with the color match. I actually think these could have been a little bit whiter. The patient was happy with it though, because she said she doesn't see herself whitening every single day for the rest of her life. And so they match really perfectly to the bottom teeth, which is the goal, because eventually these teeth will, with life, drinking coffee and wine, eating red sauce, things like that, your teeth will eventually get a little bit darker. So she was really happy with this. I think we got a really great shape in there as well. So you can see here, the teeth aren't very symmetrical. I think what you can do as well is kind of cover the top half of the gums. And that way, when you just look at the edges of the teeth, you can compare a little bit better of how asymmetrical those two are, versus in our final product, they look much better. Patient was really happy. Okay, case number 2. So this actually was a patient I saw yesterday. It was a new patient. I've never seen them before. They came in as an emergency, and she was in 10 out of 10 pain, like 11 out of 10 pain. And so sometimes when that happens with a patient, you can kind of see that they're maybe already crying or they're in tears and they are just like so uncomfortable. They can't even think straight. So in those situations, I get the patient numb right away. Before we even have a conversation, I ask, do you have any medical history I should be aware of? Do you have any allergies? No? Okay, let's put your tooth to sleep. Let's get rid of the pain, because they need to be able to think clearly. So I got the patient numb right away, and we did our full exam and x-rays, and you can see here. So this is the tooth in question. It is tooth number 5. It's a premolar. You can see there's a really large cavity right there. And on the x-ray, I can see that it's all the way to the nerve. This is the tooth that was causing the symptoms. She had a lot of other things going on, but this was her chief complaint. So we diagnosed it. We came up with a treatment plan. I told her we have to do a root canal on this tooth. And then any tooth we do root canal on, we have to do a crown, because doing a root canal, you take away the blood supply and the tooth can become more fragile. And typically there's not a whole lot of natural tooth left after we take out that cavity. So we planned a crown. And then I started talking to her a little bit more. It's kind of like a patient interview. I tried to learn a little bit more about her and what she wanted. And I said, you have a gap or space between these two teeth where you probably had a tooth taken out. I wouldn't consider her a candidate for an implant, because you can see this line right here. That is her maxillary sinus. And there's not enough space for an implant right here. So I told her, your best option to fill that space in if it bothers you is to do a bridge. And that means that we would put a crown on this tooth and a crown on this molar, and it's connected here with a porcelain pontic. And she said, I didn't think that she was going to agree to doing all of that. And she really appreciated how we were taking care of her. She said she would really like to get it done. It's really hard for her to take time off of work. So as much as possible, she wanted to get as much done. So that was great. We started moving forward after we verified with her insurance. I did the root canal. This is a cone fit x-ray here. So you can see Maxillary premolars typically have 2 nerve canals or 2 roots. So you can see here, both of them, the gutta percha, which is that filling material, is all the way up at the end. I'm not going to go through the steps of a root canal. There are quite a few, but it is one of the procedures that a lot of general dentists do not perform. I really enjoy them. I think it is such a service to the patient, especially in these situations where there is immediate extreme pain, and she needed to be out of that pain. So instead of referring her out and she would have to wait a couple more weeks, take another day off of work, I was able to address it right then and there. You can see here, this photo underneath is after I did my caries removal. So after I got rid of all of the cavity, it was really deep. You can see it got underneath the gum there. And this was my access. So you can see that was one canal. That was the buccal canal, and this was the palatal. So then we went ahead, we sealed our gutta percha in, and we did a buildup, and this is an x-ray of what it looks like after. So then we started the bridge portion, and that means that I did 2 crown preps, and takes about, I would say, 15 to 20 minutes to prep each tooth. You take a burr and you remove about 1.5 millimeters of enamel in every direction here. And like I said, that margin is really important. So you can see it here going around the whole tooth. That is the most critical part. And it's really critical to make sure you have enough reduction, which means that our crown, our porcelain, can be thick enough so it's strong and doesn't break. And there are, minimal thicknesses that are prescribed by whichever material you're using. So this was an Emax bridge, and it prescribes 1.5 millimeters of occlusal reduction, which means on the top of the teeth, and 1 millimeter of axial reduction, and axial means the sides of the teeth. So I prepped the teeth. This is photos of my CEREC scanner. So at the very beginning, where I had a photo of the whole setup, it is like a little computer that has a digital camera, like a wand. So if you've ever seen like iTero or any other type of CAD CAM technology, it looks really similar. So I scanned the the top teeth where I prepped. I scanned the bottom teeth and the bite. And if you can see these little itty bitty boxes down here, you can see I've got all 3. After I do that, it creates a digital model for me. I mark my margins. That's that blue circle that's around there. And then I get to create a restoration. So it went from this to this based on the digital scan. I added where I felt was adequate. Sometimes the machine gives me a perfect design and I don't have to edit anything. And sometimes I spend like 20 minutes. So it really varies. And the more you practice, obviously, the faster the process becomes. So I was really happy with the design after I made some changes, and then I mill it. So this is what it looks like on a 32 millimeter block. So it is literally a purple block, and I'll show you in the next slide. So it's literally a purple block that's a rectangle that looks just like this, and I get to decide how is it going to mill out of that block. And then this is our mill. So it has it's like a lathe. So it has 2 drills coming in from either side. And where the block is can move up and down. It can spin around clockwise and counterclockwise. And so really every angle can be manipulated. And it's really cool to watch. So this bridge took about 30 minutes to mill. I think it was 26 minutes. And for a crown, sometimes I think the crown today I milled took like 7 minutes. So it's so fast. Now, the reason that it's purple is because it is still in a weaker state. It's called the blue phase, which means that the structure is not crystallized yet. So the amount of strength it would take to crack that is much lower. The megapascals I forget the technical terminology. Anyways, it's not as strong in the blue phase. So it's an opportunity to mill it because it's faster to mill a softer material. And then we get to try it in on the patient and see how does that fit? And do we need to modify anything? Do I need to change the bite? I do whatever I need to do there. And then we put it in our furnace. So this is the Programmat CS. There are a lot of different iterations within CEREC. This is one of the older ones, but they all function really well. It's a 15-minute firing cycle. And what we do is we spray some glaze on it. So you can see when it comes out, it's nice and shiny and glossy. And it goes in and it gets, if you can see the temperature there, it says 438 degrees Celsius. It gets up to like 600 degrees Celsius or 700, I forget, but it's in that cycle for about 15 minutes at that super high temperature and it crystallizes it. So it makes the Emax really, really strong and super durable. So this is what it looks like at the very end. And so unfortunately, the patient could not stay for the delivery because a bridge takes a little bit longer to make. So she will be back, I think tomorrow actually, and I get to bond this on and that's it. So it was a really easy, satisfying case. She came in a lot of pain. I was able to take her out of pain and to help her with where she had that gap. So now she is a happy patient as well. I'm just gonna check the time. Okay. Case number 3. I'm gonna breeze by this one because it's not as interesting. This was just chairside veneers, so the patient was really unhappy with obviously these really discolored fillings. Instead of doing lab veneers like we did in the first case, we decided to just do them chairside, which means that we used composite material. So you can see this is the after. It's a really great outcome. For being able to do it. I think it took about 30 minutes, and that's what the patient takes home and has. But downside with composite chairside veneers is they don't last as long as porcelain. So they can chip, they can stain, and they may need to be replaced every 5 years as opposed to 15 to 20. Okay, this one's a really cool case. This is case number 4. This is a patient who basically walked in and said, I'm really unhappy with my smile. What can you do? There's a lot of challenges. The patient has an anterior flare, which means his front teeth are coming forward like that. He's got a tongue thrust and a reverse swallow pattern. So which it means that his tongue, when he's swallowing, is pushing the teeth forward. And every time he swallows or is eating or is speaking, there's that constant pressure. And that's why his teeth are flaring forward. And this is someone in his 20s. So he didn't want to go back into ortho. Ortho would have been really challenging for him because of that habit with how he's swallowing. He's got a little bit of a crossbite. So if you see right here, the bottom tooth is actually in front of the top tooth, which is not what we want. So there were some challenges, but we decided he wanted whiter teeth, he wanted bigger teeth. Let's go ahead and do some veneers here. So with veneers, we wanted to plan. We actually did 8 units, which means we worked on number 5, 6, 7, 8, 9, 10, 11, and 12. We worked on all of those front teeth to help create a fuller smile. I had my lab make a wax up for me, and then we get to do an intraoral mock-up. So before I even touch a drill to his tooth, he can see what his teeth might look like. And he was ecstatic. He was so happy. I mean, you can see it's not perfect here. It was kind of chipped, but he was so ecstatic. It basically, the case can sell itself with that, which is awesome. Made the patient really, really happy. He didn't want me to take it off. And then this is minimal preparation. So if you go back to the before photo, you can see here how much spacing he has. And we're really just adding porcelain. We're not really taking away a lot of tooth. So all I had to do here was create a little bit of a margin. I took about 0.3 of a millimeter off each tooth. So that's like a quarter of a millimeter. It's so, so thin, but we want to make sure there's going to be enough space for the restorations. So after I do my preparation, this was definitely a long day. Probably took a full 4 or 5 hours. We did a lot of work here. We did some gum surgery, etc. But I have these reduction guides here to help me verify that I've taken enough tooth structure off. So this is a scent of what the final will look like. So I'm looking at it to see, will I have my 1.5 millimeters of material to give enough strength? Yes, I do. And so we took our impressions. We took our shade guide here. So we took our stump shade and then we made him temporaries. This is what his temporaries look like. I already delivered the case. I didn't take a final photo yet. He's coming back in next week and I'll have a final photo, but patient was really, really happy. So he went from this to this and it took about 4 weeks. So that was very satisfying. And then the last case, I know I'm going a little long here. I'm sorry.
No, you're
So
perfectly
the
fine.
Okay. So our last case here is actually the patient I just saw today. So 88-year-old male had a history of or has a history of Alzheimer's, and that can be really challenging when treating patients because sometimes they're nonverbal or they are very hard to diagnose because they have forgotten what kind of symptoms they've had. They are not sure how to explain them. Sometimes there can be fear during treatment. You might not remember where you are. So it can be a very challenging type of patient to treat, but also really gratifying to be able to take them out of pain. And he just was in pain everywhere. He said, all of my top teeth hurt. He couldn't describe where. I would touch one tooth like all the way in the back and he'd say, that really hurts. And so it was really hard to figure out what was going on. Eventually, what we decided and what we saw was that he has a bridge on his front teeth. So if you look at this x-ray here on the right, you can see like a little gray shadow right there. Yeah, that is a root of a tooth that shouldn't be there. So technically, this is a floating tooth right here. There should be just a space, and there is a little bit of a root. And in this photo, you can see it. There is like a little piece of tooth that was never extracted, still there, and it was infected. But I told the patient and his wife, I said, I think if we take this out, it's going to resolve his symptoms, but it's really hard to tell what's going on just because he can't explain. So let's start with taking this out and see how he feels. He also had a really large cavity on this tooth number 4 back here. This is one of those really large metal fillings that I was talking to you guys about. Underneath this side of the filling, he had a really deep cavity. So we went ahead and did build up and crown on that tooth. So build up and crown on number 4, extract the root tip on number 9. And then I was like just finished this case, so I'm sorry the photos are not prettier here. So in terms of number 4, I went ahead and took out that big amalgam filling, and you can see here how the tooth did not look really pretty underneath. I use it's called cavity stain or caries detector anywhere that I paint it on. And I wash it off. Wherever it sticks is still a cavity. So that's a really good tool for me. You can see here there is still some decay, so I kept going. And then because these 2 parts of the tooth were really healthy, I didn't want to cut them down all the way like a traditional crown. So the beauty of CEREC is that it's all bonded, and I don't have to make him a temporary. So that creates an opportunity for me to be really conservative. So all I really did was just kind of take off a little bit on the top of each of these, what we call cusps. That way we could bond something on top, but it's not going to cut away like 90% of the tooth. I get to save all that beautiful enamel. You see that big, thick white strip? That's all enamel. And that's like the part of the tooth we want to preserve. So like I showed in that other case where with CEREC, it comes out in a purple phase. We went ahead and tried it in here. This is our try-in. You can see how much of that tooth is still left. It really just drops down to the gum line in the interproximal, so in between the teeth. We went ahead and fired the crown. This case took probably an hour and a half to make the crown. This is after we fired it and we bonded it, so that's why there's a little bit of blood there. But you can see it's a seamless transition between the tooth and the crown. You can't really tell what's real and what's not real. It matches really, really well, and they're beautiful. And this is the final X-ray here. So we were able to address that tooth. And then this was the extraction. So I was able to, without taking the bridge off, kind of going through his gums, take out this little piece of tooth. And then there was what we call a granuloma, or like an infection. It was a a big piece of tissue that came out that was just infected tissue. It was bacteria. It was probably what was causing a lot of his pain. This came out with it. And this is just a little measurement tool next to it to give you some scale on the size. Each one of these lines is a millimeter. So that's what I got to work on today. I know it was a lot of cases, but that's a day in the life of a general dentist, literally getting to do everything, getting to do surgery, cosmetic work, getting to change people's smiles, take them out of pain, doing root canals. It's a fun, fun and exciting job. So let's wrap up here with some advice to future dentists. I would advise everyone to really figure out your learning style. Like I said, you're going to always be learning through your undergrad, through dental school, and after. The learning never stops. So start to shift away from cramming. I know in undergrad, all I did was cram. I would just like do all-nighters in the library the night before exams. Like I didn't really know how to learn the material and internalize it. I knew how to cram it. So figure out how you best learn and start to build those habits now, as opposed to cramming, because it's going to come in handy. Like I talked about at the beginning, learn about personal development, leadership, money management. These are all things that are really important as a dentist that you don't get to learn in dental school unless you take your own initiative. So I recommend start that process now. Build healthy habits now. The better you are and the more prepared you feel when you have the time to prepare, the easier it is to lean on those healthy habits when life gets really stressful. And dental school is really stressful. So you want to have those healthy habits in place. Find some non-dental related hobbies that you can start building now. So like I mentioned, for me, it's yoga, working out, eating healthy, traveling, hiking, things like that. So I really was able to develop those hobbies before starting dental school. And as a way to manage my stress and to stay sane during dental school, I got to play in those hobbies. And now, as I'm working, that's where I spend a lot of my free time. So to have something to fill that time is really great. Prioritize wellness and living a well-rounded life. School is not everything. Being a dentist is not everything. I do not define who I am by my profession. While it is a huge part of who I am, it's not all that I am. So just know you're not just a student, you're not just a pre-dental student, you are much more than that. So really lean into those hobbies and side hustles and wellness. And don't wait until XYZ to start living your life. So don't wait until you finally hit submit on your application or you get into dental school, say like, I'm gonna finally start dating or finally find or go on this trip after I do that. Don't wait, because you never know when a global pandemic's gonna hit or when something can happen in life. And I think experience life is here to live, and don't keep waiting to start, especially in dental school. So I hope that was some helpful information, and I am excited. If you guys have any questions, I'm happy to answer them now, and you can find me on social at Dr. Shavasana.
Thank you so much. So we do have a few questions.
Yeah.
The first question is, what were your top 3 must-haves when choosing a dental school?
Good question. Clinical experience. The Michigan program, we are starting to see patients in our first year. So I was looking for a program that I was able to start treating patients as soon as possible and walk away with the most clinical experience possible. I would say culture. University of Michigan is in Ann Arbor, which is a really fun city. There's a lot of food and art, and it has a big like college sports culture. So that was a fun, it made being in school really fun. And the third thing I was looking for, mentorship. So if you know someone who is in dental school somewhere else and you guys will overlap, that's a really key tool. I was a D1 when my sister was a D4. So I was able to she gave me her old notes. She kind of like warned me about certain professors. It's like having literally my big sister there. But if you have a friend that's in dental school somewhere else, if you have like an acquaintance from the pre-dental club at your college that's in dental school somewhere else, like lean on them. And that could be a factor in picking that school.
How was the adjustment from dental school to real world dentistry?
It was definitely hard. The first 6 months are a learning curve. You are thrown into the deep end, and it's like a sink or swim type thing. And I think it took about 6 months for my speed to get up to pace. You know, in dental school, we've got 3 hour long appointments. And then going into practice, those 3 hours became, okay, you have 30 minutes to get this done. And so that took me like about 6 months before I felt confident. And it was exhausting. I would come home every day for the first 6 months and just be super tired because your brain is on and you're working hard. After that 6 month period, I was able to like really then use my time after work on like my hobbies and things like that. So it's an adjustment period, but it was short.
Did you ever consider specializing, and what led to your eventual decision to focus on general dentistry?
I did think about specializing. I think if I were to go back and do something, it would be endodontics, so root canals. The reason I did not decide to specialize is with general dentistry, I can still do a little bit of everything. And it's, I can still pursue being being really good at root canals without limiting myself and not being able to do all these other things. I really love doing cosmetic work as well. So I think to me, specializing felt like boxing myself in.
Did you learn to use CEREC in dental school or after you graduated through CE courses?
It's a good question too. So I just started learning about it probably in my 4th year of dental school, and I had only done one restoration with CEREC. It was like just becoming part of the curriculum. Now I know the program at Michigan, the first years, that is like they're learning it day one when they get there. So I think it's changed in the curriculum just because the world is changing and becoming more digital. I myself learned it in my first associateship. So I mentioned I worked for Pacific Dental Services. It is a corporate dental practice that emphasizes the use of CEREC, and they offer really great CE. So they fly every associate out to California for a week, and you do like a week-long training. And that was made worth working. Sorry, it made it worth working in corporate just for that experience. So they really prepared me. And I think I don't know how many hundreds of crowns I've done now, maybe thousands, using the CEREC. So it's experience as well.
How did you prepare for your dental school interviews? Were there any books or videos that you used to prepare?
I might pass on this question. I don't remember what I did. I think I Googled like what are the most commonly asked questions, and then I just kind of like wrote down what my answers would be, and then I practiced with a friend. I think there's some higher tech versions of that now. I know there's some people like that I follow on Instagram who do like interview coaching and whatnot. So I would say if you know what school you're interviewing at, look at what their interview process is like. At Michigan, they do MMIs, which is multiple mini interviews, which is like a very different thing than just a one-on-one interview. So look into what type of interview process is happening, and then see if there's someone that can practice with you.
Do you still attempt to shade match composite when its restoration is on a back tooth that won't really be seen?
Yeah, we always want the patient's tooth to look the most natural. We always try to shade match.
If you plan to open your own practice, how do you plan to get knowledge on the business side of dentistry?
It's a great question. There are a lot of really great CE courses about the business of dentistry. I think dentists are really tapping into the power of social media as well. So I've connected with a lot of dentists on Facebook and Instagram who've created groups like mastermind groups or just like resources to share. My sister opened her own practice 2 years ago now, and she did a course called the Breakaway Seminar, which is here in San Antonio, and it's supposed to be a really awesome way to help you create a startup. So I would definitely pursue like some type of structure and a system to starting a business because it is a very complex thing. I don't ever see myself owning though. I really like coming home at 5 and not having to worry about anything.
How do you try to reassure patients who experience dental anxiety?
I think actually being a yoga teacher has been really helpful for that. So I was, with patients who are anxious, I'm able to coach them in a way that I coach my yoga students. Breath work is really common. So being able to like coach a patient of how long they should inhale, inhale for 5 seconds, exhale for 7. There's different exercises we can do, and just like learning how to speak to patients in a really calm manner. If something goes wrong, I never show that to the patient. They think that everything is 100% okay, and that keeps them calm as well. So just learning how to like manage stressful situations. And then obviously medication. At my practice, we don't do nitrous oxide or oral sedation or IV sedation because our patients don't really need it. But in a lot of different practices, that is, you always get laughing gas, or you can take like a Valium before dental treatment. So that works for some patients as well.
Awesome, thank you. So that's all the time we have for questions. I will send out the attendance quiz in the chat for everybody to take. Thank you so much.
You're so welcome. Right. Thank you. Feel free to contact me. DMs on Instagram are always open.
Thank you so much, Dr. Kamodia. For everyone that's viewing, her Instagram handle is right on the screen if you guys want to follow her and keep up to date with her. Like Kathleen said, the quiz link is now posted in the YouTube live stream chat. You can also find it on our link tree, which is in our Instagram bio and in the group me. And thank you again, Dr. Kamodia, for all the time you gave us today. And make sure everyone that's watching to tune in for our next session on tomorrow at 8 p.m. Eastern.